Today, let's start a new chapter, Inflammation. I'm Chen Ye from the Department of Pathology. In this chapter, we'll talk about the following contents. Section 1. The concept of inflammation. For inflammation, I think we are not unfamiliar. Some common diseases such as gastritis, appendicitis, pneumonia. These diseases are actually inflammation. In fact, more than 75% of all diseases are inflammation. So, I have a question. Do you think inflammation is beneficial or harmful? You might think that inflammation makes me feel painful and uncomfortable, and of course, is harmful. Although in common medical and lay parlance, inflammation suggests a harmful reaction. It's actually a protective response that's essential for survival. The survival of all organisms requires that they eliminate foreign invaders, such as infectious pathogens and damaged tissues. These functions are mediated by a complex host response called inflammation. So, what is inflammation? This is the definition of inflammation. Inflammation is a protective reaction of the living tissue which developed blood system to all forms of injury. Inflammation accomplishes its protective mission by diluting, destroying, or otherwise neutralizing harmful agents, and the wounds will eventually heal and repair in the site of injury. Without inflammation, infections would go unchecked, and wounds would never heal. The main components of inflammation are a vascular reaction and a cellular response. It involves vascular, neurologic, humoral, and cellular response at the site of injury. This picture shows the components of inflammatory responses and their principal functions. Look at the picture. Here is a blood vessel. The cells and molecules of host defense normally circulates in the blood, and the goal of the inflammatory reaction is to bring them to the site of infection or tissue damage. Several types of cells and molecules play important roles in inflammation. These include blood leukocytes, and plasma proteins, cells of the vascular walls, and extracellular matrix proteins, and the cells of the surrounding connective tissue. When microbes enter a tissue or the tissue is injured, the presence of the infection or damage is sensed by resident cells, meaning macrophages, but also dendritic cells, mast cells. Then these cells can release mediators such as cytokines, histamine, and other mediators that induce and regulate the subsequent inflammation reaction. Inflammatory mediators are also produced from plasma proteins. Some of these mediators promote the influx of plasma and the recruitment of circulating leukocytes to the site of injury. The recruited leukocytes are activated, and they try to remove the offending agent by phagocytosis. When these harmful substances are removed, the reaction will be controlled and terminated. The damaged tissue will be repaired. The steps of inflammatory response can be remembered as the 5 R's. First, recognition. The harmful agent, which is located in extravascular tissues, is recognized by host cells and molecules. Second, recruitment. Leukocytes and plasma proteins are recruited from the circulation to the site where the offending agent is located. Third, removal. The leukocytes and proteins are activated and work together to destroy and eliminate the offending substance. Fourth, regulation of the response. When the harmful substances are removed, the reaction will be controlled and terminated. And the damaged tissue will be repaired. That's the last R, resolution or repair. Although normally protective, in some situations, the inflammatory reaction and the subsequent repair process can be capable of also injuring normal tissues. Therefore, injury may accompany entirely normal beneficial inflammatory reactions, and the pathology may even become the dominant feature if the reaction is very strong, prolonged, or inappropriate. Okay, now let's talk about the section 2, causes of inflammation. Inflammatory reaction may be triggered by a variety of stimuli. The most frequent causes are listed as follows. Microbial infections are the most common causes of inflammation. Microbiologic agents include bacteria, viruses, fungi, parasites, etc. The picture shows a marked redness and swelling of the facial skin. This is an acute inflammation caused by streptococcus. This picture shows the patient with blisters on the skin caused by herpes virus infections. The two pictures show hard chancres, which are caused by syphilis infection. Physical agents include trauma, extreme heat and coldness, irradiation, etc. For example, after enjoying sunbath, the person has sunburn on the back. This inflammation is caused by ultraviolet ray, a physical agent. Chemical agents include irritants or corrosive chemical substances such as sulfuric acid, nitric acid. Chemical substances such as cosmetics may also cause the skin damage. The picture shows a marked redness and swelling of the facial skin, called cosmetic dermatitis. Necrotic tissue may cause inflammation. Some molecules released from necrotic cells can cause inflammation. So, look at the picture. There is a dark red hyperemic zone on the edge of the necrotic tissue, which is essentially an inflammatory response. Foreign bodies such as splinters, dirt, sutures may elicit inflammation by themselves or because they cause traumatic tissue injury or carry microbes. This picture shows a piece of plant accidentally inhaling into the lungs, causing granulomatous inflammation. This is a foreign body giant cell. It's huge and the nuclei arranged in disorder. Immunological reactions are reactions in which the normally protective immune system damages the individual's own tissues. For example, SLE is an autoimmune disease that occurs when the body's tissues are attacked by its own T cells. There are many red spots on her face. Okay, now let's make a summary for the two sections. We have learned the general features and the causes of inflammation. Inflammation is a beneficial host response, but also may cause tissue damage. The main components of inflammation are a vascular reaction and a cellular response. Both are activated by mediators that are derived from plasma proteins and their various cells. The steps of the inflammatory response can be remembered as the 5 R's. The first one is recognition of the injury agent. Second, recruitment of leukocytes. The third, removal of the agent. Fourth, regulation of the response. And the last one is repair or resolution. The causes of inflammation include infections, tissue necrosis, foreign bodies, trauma, and immune responses. And the microbiological agents is the most common causes of inflammation.